Hello, everyone, and welcome to our Genie Product Update. And thank you all for joining us here today. I'd like to begin today by acknowledging the traditional custodians of the land on which we stand. And for me, in Brisbane, that is the Turrbal people and the Yagara people. And I'd also like to pay my respects to elders past, present, and emerging. My name is Neve Tobin, and I am the Director of Product Strategy and Design at Magentus. And I'm excited to have the opportunity today to share this update with you. Joining me will be Sachandra. Sachandra is our Genie Product Manager. And today, Sachandra is going to chat to you about the Genie Product Roadmap. So starting with sharing what we've released recently in what's new and improved. And then talking about what you can expect to see in the Genie product over the coming months as well. I'm then going to come back in and provide an update on Gentu for those of you that might be considering a shift to the cloud in the near term. Now, we are going to have time for Q&A at the end. So please add your questions to the Q&A function throughout the webinar. We'll actually do our best to respond to those questions as we go, but then we'll also call out some as well at the end or respond to any that we weren't sure of at the end. Now, before we jump into the product roadmap updates themselves, I just want to spend a minute sharing a little bit about our platform vision, as this is how we see ourselves helping you, the medical professionals, deliver better health outcomes over the coming years. And this continues to be centered around our technology platform that we've been working on for a few years now. This foundational platform is really important because it's what's going to enable us to provide you with ongoing product innovations for Genie into the future. Some of these we're going to continue to develop ourselves within core Genie, and some of them would be integrations that we do with third-party products. But these innovations are going to be centered around three key objectives. The first one is, improving the patient experience by providing tools for practices to automate the patient journey. The second is focusing on how we can connect up the disconnected ecosystem and ensure that the data that you need to make decisions at the point of care with patients is readily available. And the third area is to bring data-driven insights into your workflow. So this includes things like clinical decision support, workflow assistance, and business performance insights so that you can understand how you can improve your practice's performance. But of course, this all only works alongside Genie and Gentu, our core practice management systems. And so the updates that Sachandra will focus on today will be really centered around what you can expect in core Gentu. And then I'll give a bit of an update on, core Genie. And then I'll give a bit of an update on Gentu just after. Now, in making decisions about what we're going to do from a product roadmap perspective and to improve the core experience for Genie and also get Gentu ready for Genie customers to move across to in the coming months, we really have been listening to feedback on what needs to change. This is just a reminder about our Voice of Customer program, which is really centered around capturing all feedback that you provide us. So this could be an interaction that you have with a support person, a trainer. It could be a conversation that we've had at a conference or when we've been on site. But every interaction we have with customers is captured in our Voice of Customer repository. And we regularly review that to understand, what is the most important thing for us to focus on from your point of view. Now, the feedback we've received so far for Genie continues to remain around three core workflows. One, which is consulting with patients. The second, around managing outgoing correspondence. And the third, around booking and managing appointments. Within this consulting with patients area, the topics in here have evolved, I suppose, a little bit over time. But we have over 100 requests for improvements to the diagnostic request workflow. Primarily, this was centered around digital pathology requests, which Suchandra will talk to you about shortly, where we have good progress with Sonic Healthcare and Helios Labs now for digital pathology requests. But it's also about that digital pathology request workflow and how tightly integrated it is in the Genie experience. In relation to, sorry, it's just jumped down one. In relation to, sorry. E-prescribing, the types of, obviously originally it was to have e-prescribing capability, but now what customers are asking us for is to have that e-prescribing functionality, again, more tightly integrated into the clinical workflow within Genie, to be able to see, you know, the status of how an e-prescription was sent to the patient, and also to be able to do multiple prescriptions in a singular e-prescription is really highly requested. Ooh. With respect to managing patient appointments, the themes of feedback in that area were really centered around improvements to SMS or appointment reminders. We had over 150 pieces of feedback in this space. It also included things around improvements to referral validity, admin notes, being able to manage telehealth appointments, and also auditing appointment book changes. But Suchandra is going to talk to you about that in a bit more detail shortly, because a lot of change has actually gone into creating and editing SMS appointment reminder templates in the last number of months. Now, in addition to our Voice of Customer program, we also sometimes do customer engagement surveys. And this is from a survey that we did last year, where we asked about, you know, what integrations customers wanted to see with Genie into the future. And two of the ones that were really highly requested was digital requests again, so pathology and radiology, followed by practice account integration, integrations for direct GP specialist communications, and then electronic bookings to private hospitals. So we're really excited to be making progress on two of these integrations. One, which is the pathology e-requesting, which, as I mentioned, is now available, or has been available with Sonic Healthcare for a number of months, and is now just available with Helios Labs, which are QML, Dorovich, and Laverty, and also e-bookings, which is a digital pathology booking solution that we currently have available with HealthScope, and Suchandra will talk to in a bit more detail very, very shortly as well. So we really are listening to the feedback that you guys are giving us, and I think you'll see as I hand over to Suchandra and she talks about, you know, what we've done recently and what's going to be coming in the future roadmap, that you can see how these themes have flowed through. So look, thank you for taking the time to share that feedback. And we really just want to encourage you to continue to share that feedback to help us stay informed on what you would like to see improved. And then over to you, Suchandra, to start to chat us through what's new and improved recently. You're just muted.
Yeah. Thanks, Neve, and good afternoon, everyone. Good afternoon, everyone. I'm Suchandra, the Genie Product Manager, and I'm very excited to share the Genie Product Update with you along with Neve. I will start with what's new and improved in Genie. Genie version 10, the 64-bit version, was launched last year, and over 80% of our practices are now in version 10 of Genie, including some big practices of 59 users. There were some performance-related feedback which we have addressed very seriously last year, and based on our user feedback, we are now extremely confident that the latest version of Genie are very stable. Last month, we also released 10.3.2, which complies with the new air regulation and lots of enhanced air functionalities, which I will go through in the following slides. 10.3.2 also includes performance improvements, real-time prescription monitoring, e-booking, e-requests, and a modern and improved SMS automation manager. We strongly recommend practices who are still in V9 or lower versions to upgrade to the latest version of V10 to start using the new feature and get more ways to save time. Also, please feel free to reach out to us if you need any help in upgrading to the latest version of Genie. We always value and love the feedback we get from our users. And based on the feedback we received, SMS improvement was a top requested feature from our Voice of Customer program. The main thing our users requested was the ability to send appointment reminders per appointment type so that the relevant information can be sent to the patients based on their type of appointment, along with the use of various references in the SMS templates. Based on the feedback, we have done a major overhaul of the feature so that is valuable to our users. This new functionality is being released as part of Genie 10.3.1. This will allow you to send appointment reminders tailored to your appointment type. You can now create and send specific appointment reminder message to telehealth consult and a separate reminder message for a new patient appointment type. You can now create multiple SMS templates at a centralized place in the Templates tab, and then select which template you want to send for different appointment types and for which practitioner. Practitioner A may want different message to be sent to patients for their telehealth consult than practitioner B, which is now possible in the latest version of Genie. You can also now use the insert field button to insert fields into the message. These fields will automatically add information relevant to an appointment, such as the appointment date, day of the appointment, provider, etc. If it's an appointment is on Monday, Tuesday, or Thursday, that's included in the message now. Place your cursor on the position you would like to add the field. Simply double-click the field to add it to the message. Alternatively, you can drag and drop the field into the desired position in the message. Some practices may only need the rooms to be different in their appointment reminders. And in that case, please insert room as a reference. And while sending the message, the system will pick up the correct room in which the appointment is booked in before sending. By following this practice, you don't have to manually update the room information in the template every time before sending a message. When you first open the SMS Automation Manager, you will be taken to the Overview tab. This will display a list of your current appointment reminders for your users and appointment types alongside the assigned template. If you have updated from a previous Genie version and have set up and assigned templates to your providers, this will be imported into the new SMS Automation Manager and will appear in the Overview tab. You do not need to change anything if you are happy with your current setup before upgrading. You can modify the appointment reminder template setup for a certain combination of user and appointment type by right-clicking and selecting either View Assigned Template to change which template is assigned, or View Template to edit the template itself. You can also double-click a reminder template to be taken to the Assigned Template tab. From the Assign Templates tab, you will be able to unassign SMS template for a user, an appointment type by holding on the Alt click and clicking on this plus button. If the template should then be unassigned, and it will continue using the default template, which will be reflected in the Overview tab also. This is specifically handy if you have accidentally assigned any template and want it to be reverted back. Based on the feedback from some of our users after the release of SMS, we have identified that template priorities can be complex to navigate. Therefore, we want to spend some time to clarify and explain the prioritization of templates. It is important to understand that only one template will be utilized for appointment reminders based on the priority, and the highest priority template will be selected. Once you upgrade to the latest version of Genie, all your current templates will be shown under all users and all appointment types, unless you spend some time and assign specific templates for specific users and appointment type. If you have assigned a specific template for a specific user for a particular appointment type, that configuration will take the highest priority. And while sending SMS for the specific user and the specific appointment type, that template will be used. If you want to configure a template for a specific user, but for all appointment types, that will get the next priority. That template will be used for all appointment types for that specific user. Similarly, if you want to configure SMS template for all users for a specific appointment type like telehealth, that will get the priority 3. For example, if a practice want to send a specific SMS message for all their practitioners for telehealth appointments. By default, you will always have an all users, all appointment type reminder available, which can be assigned any template. This serves as a default reminder that will be sent if no templates are assigned to the specific user or the appointment types. Therefore, if you prefer to send a single message to all doctors and all appointment types in your practice, you can solely rely on the all users, all appointment type reminder configuration. Based on the above understanding of the SMS priorities, let's look at this example now. When multiple reminder messages are configured, the template selection follows a hierarchy where the most specific user and appointment type selection takes precedence over the general ones. Try to give you a breakdown based on the image in the presentation. If you look into the priority 1 reminders, this takes the highest precedence as they are set for specific provider and for specific appointment types. In this example, Dr. Bray has a template set for his follow-up appointment, which will take the highest priority compared to the generic ones. If you look into the priority 2 reminder, this is for a specific user, but for all appointment types. In this example, Dr. Bray has a reminder set for all appointment types. However, since Dr. Bray has a specific reminder for follow-up appointments, this priority 2 reminder will apply to all appointment types except the follow-up appointments because that will fall under the priority 1. Priority 3 reminder, which is for all users but for specific appointment type. In this example, there is a reminder set for all users and new patient appointment types. It will send for any new patient appointment except those involving Dr. Bray, whose specific all appointment types reminders take priority. Last is priority 4 reminder. This reminder applies to all users and all appointment types that are not covered by any high priority reminders. This is the fallback setup applicable for all if there is no specific template assigned. Understanding this hierarchy ensures that your reminders are sent according to the specific criteria you have set within Genie. Also, please feel free to reach out if you need any help in setting up. We would love to help you in the process if needed. Another big thing in addition to SMS is AIR. And now I'm going to tell you regarding AIR changes done to be compliant with the new AIR regulations. As of March 1st, 2024, the Australian Immunization Register have introduced new reporting requirements when vaccines are administered. From this date, the administering vaccinations will need to report the route of administration for Japanese encephalitis vaccines, the information about the vaccine type for all vaccines prescribed by the AIR rule, like COVID-19, influenza, and for some vaccine, it is now mandatory to report the batch numbers also. We have been through the conformance testing with the government agency and are really excited to announce that 1032 is now compliant with all the new AIR regulations. In addition to the compliance work, we also introduced a brand new AIR portal in Genie, now available for all Genie users, allowing you to conveniently manage a patient's immunization. We understand that the AIR provides doctors with access to up-to-date immunization records of their patients. This information is crucial for ensuring patients receive appropriate vaccinations based on their medical history, age, and specific health conditions, thereby enhancing their overall patient care and safety. Earlier in Genie, you can only record an encounter of vaccine, but now in the new version, you will be able to view patients' immunization history along with the ability to download a patient's immunization history statement. You will be able to view patient contraindication history and natural immunities also. Additionally, you can also review vaccine trial information, track vaccination schedules, and identify patients as part of special risk group. As we have seen in the earlier slides, we did a survey last year, and most of the most requested integrations were e-request and e-bookings. Just to refresh the memory what e-booking is all about, e-booking streamlines the digital procedure booking system, initially available for HealthScope hospitals, with the plans to expand to others over time. This new workflow electronically transfers patient and procedure details from Genie to hospital booking teams, eliminating the need for draft theater list and reducing the paperwork errors. Since launching a pilot with HealthScope in May and a national rollout in September last year, practices have reported significant efficiency gains. Admin time for managing booking has been reduced, and patients now receive timely confirmation of their procedure bookings, enhancing their overall experience. To benefit from e-booking, Genie users need to be version 10.7 or later. Detailed setup instructions are available in our knowledge base articles. As we discussed last time, eRequest has just launched with Sonic Healthcare, which includes Sullivan Nicolaides, Douglas, Manley, Hanley Moore, Melbourne Path, and Clinipath. We are making great progress and can now announce that it's also available for Helios Labs like QML, Levity, Dorivage, etc. I would like to provide a brief overview of eRequest for those who may not be aware. eRequest is a new digital pathology requesting workflow integrated into Genie at no extra cost. With eRequest, you can now create, send, and track digital pathology requests directly to the lab. Patients receive SMS notification instantly, which eliminates the issue with the lost request forms. Just to remind the benefits that our practices are seeing, improve visibility and efficiency in tracking lab requests, which includes reducing follow-up calls and emails, simplified process for remote patients with SMS notification, thereby minimizing administrative tasks, enhanced patient outcome, and streamlined tracking and reduced transcription errors compared to paper-based methods. To start with eRequest, ensure your Genie version is updated and visit our knowledge base for setup instructions. I hope it has been helpful to hear what's available in Genie and in the latest releases of Genie. Over the coming months, you can expect more improvements in Genie product. Let's look into what's coming soon in Genie. As we all know, based on the recent cyber incidents, cybersecurity is essential for any software to protect user data and prevent malicious attack. And it is very important for us that we ensure Genie is always secure. In regards to that, we will be working on upgrading to the latest version of 4D. The underlying technology Genie is built on to enhance the security for our Genie application while delivering the additional improvements and bug fixes. This version is the most performant and maintainable version of Genie available today. Version of 4D available today. We are conscious that we have been a bit behind in the OS compatibility in the past. Therefore, we felt it was very important to upgrade to the version 20 so that we will be certified to the latest version of Mac OS, which is Mac Sonoma. This will ensure compatibility and security compliance with the latest, newest operating system as part of the updates. As part of the upgrades and improvements in our infrastructure, we will be able to make Genie releases faster and continuous. If a clinically significant bug is reported, we expect it to be released to our users as soon as possible. There may be multiple releases in the year, though it is always recommended to be on the latest version of Genie, but we completely understand if a user are a few minor versions away. But please make sure that you are always on the latest version of Genie. For example, right now it's version 10. Sometimes we also get question if we are going to continue support the Genie product. I want to ensure that as we continue to grow our Gentu product to be suitable for our Genie users, so that Genie users can migrate to Gentu when they're comfortable. But we also believe and understand Genie will be leading desktop product for many years to come. In future, we will work towards ensuring that we are always on top of the latest version. Later in the quarter, we will work on deeply integrating e-booking with Genie, transforming your theater booking process by eliminating inefficiencies and enhancing operational simplicity. Since e-booking was released, we have received multiple feedbacks regarding double handling of e-bookings, as it was in a separate model and was not completely integrated within the Genie product. There is also double handling included during creating and updating of e-booking. We have looked into all the feedbacks and therefore looking to reduce the double handling and make the user experience seamless while creating e-booking. In the coming days, we may reach out to you to validate our solution so that we can have your inputs early in the process of development. As we know that Genie is conformant with version 2.3 of e-prescribing, which will be decommissioned by June 2025. We'll spend some time to work on the e-prescribing version 3 conformance to continue supporting our users who benefit from using e-prescribing in Genie. Achieving compliance with e-prescribing 3 is essential as it requires adherence to the security standards outlined by ERX guidelines. These standards ensure seamless interoperability, data integrity, security, and also accuracy when transmitting prescription information between the healthcare providers and the pharmacies electronically. By complying with the prescribing version 3, we streamline the electronic prescribing process. We will be able to enhance patient safety and also improve overall efficiency in healthcare delivery. We also received some feedback regarding e-prescribing, which Neve has mentioned in the earlier slides, and we plan to work on some feedbacks during the EP conformance timeline also. As you can see, there's lots happening in Genie. So we will continue to focus on making it better for Genie customers to make sure you have the best experience using the Genie product. I would like to personally thank you for all your support and continuous engagement. I'm working as a product manager in the Genie product for the last 18 months and has been the most rewarding journey of my career. I love talking to you all, so please don't hesitate to reach out to me for any suggestions or improvements you would like in the product. Though I cannot promise much, but I want to reassure that I am listening and take those feedbacks very seriously. All the feedbacks we get from you help us in shaping the product. So please keep it going, and thank you all. Now I'm going to hand over to Neve, who will talk to you regarding our Gentu product, and then I will be back for the Q&A.
Great. Thank you, Suchandra. Thanks for talking us through, what's happened recently for Genie and what we can expect to see in a couple of months. And great questions coming through in the Q&A that I've been trying to respond to as we went for a couple of things that will actually come on the roadmap after e-prescribing and the version 20 upgrade. So good to see that there's alignment there on even what's going to come next and further down the line as well, which we can touch on a little bit in the Q&A at the end also. Now, as Suchandra mentioned, I'm going to chat to you a little bit about Gentu. And the reason is that we know for many Genie customers on the call today that there is interest in moving to the cloud. We certainly understand the challenges and the costs of running hardware locally. And we really do appreciate that Gentu can give practices the flexibility they need to run a busy practice. And so this is why we're continuing to step up, progress on getting Gentu ready for you. One of the questions that I did just answer in the Q&A was, will Genie customers have to move to Gentu? And the answer to that is no. We're ready. What we want to do is make sure that Gentu is ready for you when you're ready to move. There is no plan to force customers to move from Genie to Gentu. And if anything, as Suchandra has just shown, we really want to make sure that your guys are reassured that we will be continuing to invest in the Genie product for many years to come, because we do anticipate that Genie customers will remain on the desktop for an extended period of time. But on Gen2, really excited to share a general update on Gen2 today, just so people can get a sense about the progress that we're making there, and also get a sense of how Gen2 is growing. And as we look at the number of specialist practices moving to the cloud, we know that about 40% of Australia's specialist practices have made the shift now, probably slightly more than that. And over half of those are actually using Gen2. So this definitely makes Gen2 the fastest growing cloud practice management software. And really excited to share that as of the end of June, we now have more than 2,000 practices using Gentu. So this means that Gentu practices are supporting the care of more than 14 million patients and have provided 47 million appointments and 5.6 billion in health services, which is just a huge impact on the Australian health ecosystem as that number continues to grow and grow. Now, a question we do often get asked by Genie customers is, is Gen2 suitable for my practice, or when should I move? And I guess to give you a bit of a sense of who has already moved, if we look at the diagram over on the left-hand side, we can see a breakdown of the range of specialties that have moved from Genie to Gen2. And certainly the main groups there are orthopedics, obstetrics, and general surgery. And that's been a consistent trend now for a number of years. Interestingly, though, we are seeing an increased number of gastroenterology, urology, and plastic surgery practices having moved more recently, kind of in the last 6 to 12 months. Also, over on the right-hand side, if we looked at this a couple of years ago with regards to the practice size, we primarily, I think it was 80 or 90% of the practices that were moving were a single practitioner practice. And this mix has changed quite considerably. And as you'll see now, the majority of practices that have moved from Genie to Gen2 are actually those practices with 2 to 3 practitioners, and even larger. I think the largest, or not the largest, but there certainly is some practices with 10, 15, and 20 practitioners now using Gen2, and Genie practices that have been using Genie for more than 10 years as well have successfully made that transition across. So, while there might still be, and there will always be, some differences between Genie and Gen2, what we're finding is that Gen2 now has broad suitability for a significant number of Genie practices. And so if you are considering a move to the cloud, please reach out and chat to our team, because they're going to be the ones that are best placed to help you understand, is now the right time for you, or when is the right time for you to make that move. Now, over the last 3 months, since we did our last webinar, lots has been happening in Gen2, again, with the lens of getting it ready for Genie customers to move. And probably there's 2 big areas of focus. The first area of focus was invoicing and quote templates. So practices can now create multiple invoice and quote templates, and this allows them to include different letterheads and doctor-specific information, which we know is really important for multi-practitioner sites, and allowing people to add in information that's specific to a practitioner, such as payment details, payment terms, and so on. Invoice templates can now also be defaulted on a per practitioner basis. For quotes, you can also choose to format things like how item descriptions are displayed and manage how the estimate of cost formatting is controlled. And this is just so that you can have control over what pieces of information are highlighted for the patient. And then finally, we introduced the ability to, or not finally, actually, 2 other things. We introduced the ability to create third-party quotes. So this is to enable you to be able to quote groups like work cover, and then finally voiding quotes in the patient's account history as well. Earlier in the year, the team released what we called, or is the equivalent of, the process folder in Genie, which allowed practices to upload, link, and process documents, so scanned in documents or files, to patient records in bulk. The other area that we have done a lot of work in the last 3 months is really an extension of this work, and updating the reviewing document process. So one of the first big changes included the automatic linking of documents to a patient's file without any action needing to be completed by the user. So what this means is that if a document has been received by a practice, if the doctor happens to see the patient and is in the patient's clinical file before they've had a chance to clear their inbox for results and letters, that document will be in the patient's file, and they'll be able to review and action that document from within the patient's file. The team also separated linking and reviewing. So we heard from some practices that they wanted to be able to, or admin people wanted to be able to link documents while still having a separate process for reviewing documents, and that needed to be completed by the practitioner. So that has been separated. And then other small changes that have been made include the ability to assign documents to other practitioners, which is obviously important in multi-practitioner settings or if you're covering leave for somebody. We introduced an audit bar, which tracks any interactions that have happened with a document. So you have visibility who has viewed or actioned that document, and that really is just around risk management. And then finally, we introduced the ability to SMS a patient from a document. So this specifically relates to diagnostic requests, where if you want to notify a user to call the practice to make an appointment or something, or just notify them that no action is needed on the pathology request, it's now possible to do that as part of the workflow within Gentu in the way that you have been able to do it in Genie. Also in the templating space, the team finished off work on procedure templates. So very similar to Genie, in Gentu, you can now create templates that will allow you to pre-fill information to be used both when creating the procedure, so the administrative information, and also when you're doing your operation notes. And this is just all about reducing the amount of time information needs to be filled in over and over again. And then outside of Core Gentu, we also continue to make really great progress on our mobile app, which was made available to all Gentu users late last year. So earlier this year, we added the ability for users to be able to view anyone's appointment book. So as a practitioner, I can view another practitioner's appointment book, or as an admin person, I can use the app to view another practitioner's appointment book. We also added the ability to create consults, create tasks, add patients, so create new patients on the go. And then last week, we released our biggest update yet, which included the ability to review and action incoming diagnostic requests, results, sorry, from the app. So this is a huge step. This is one of the most highly requested features from the mobile app perspective, from feedback that we had on the mobile app, and already we're seeing lots of people interact and start to use that in the app. Now, next for the mobile app, the team is going to focus on tasks and notifications. So we know that when practitioners or people are away from the rooms, you want to be able to stay on top of your tasks list. So the intention is that we will make available the tasks list within the mobile app, and we're also going to do our first piece of push notifications. So what this means is that people would not need to log into the app to then see if an action required their attention. That would actually be pushed up as a normal push notification for an email or an SMS message that people are used to get practitioners or users attention. And then I guess looking forward outside of the mobile app, within Gentu, we are going to be working on our multi-factor authentication experience. This is already available on our web login, but not on our mobile login. And multi-factor, significantly enhances cybersecurity for users, as it requires multiple forms of authentication before anyone can access sensitive practice information. So really a great additional layer of security. So we are going to be introducing that to the mobile app and enhancing the experience on the Gentu web login, and really want to encourage all practices to start using that over time. From here, the team is going to get stuck into letter writing enhancements. So we do have feedback from existing Gentu users and also Genie practices just about the breadth of letter references that are available within Gen2. And so we're going to be adding in new references for demographic information, clinical, antenatal, pronouns, and also date selection. So to be able to choose an alternative date from today or yesterday for things like consults and procedures and so on. Separate to this, the teams will also enable the ability to email letters to third parties. So in Gentu today, you can email documents to patients, so send quotes, invoices, letters to patients, but now we'll be enabling the emailing of documents to third parties, so practitioners or anyone else that are involved in the patient care. And then alongside this work, we're also going to be revisiting our OBS and Gynae modules. So last quarter, we formed a craft group with a number of existing Gentu and Genie practices. And from that, we identified a number of needs, including the ability to be able to reopen closed pregnancies, and also the desire to want to be able to manage multiple babies within a single pregnancy record. And then last, but certainly not least, we're conscious that many practices use products in their practice that do not currently integrate to Gen2. So Genie does obviously have some existing integrations with online appointments, forms, and so on. So the Gentu marketplace will be launching in the coming quarter. The team has been working behind the scenes for over 12 months now, getting this ready. Our initial use cases will be transcription and digital consent, but then they're going to be followed by patient forms and online appointments as we head towards the second half of the year. So look, as you can see, lots happening as well to build on Gen2 capability, and we'll make sure that we continue to continue to get it ready for Genie customers to move when they're ready. And also we'll continue to keep you informed in webinars and other communication on the progress with Gen2. So look, thank you all for joining us. We really do appreciate the time that you take out of your day to stay across what's happened recently and what's coming up. And thank you for all of that engagement regarding the questions. Hopefully we've been able to answer the bulk of them and give you a better sense about what you can expect in the roadmap in the coming six months or so. So thank you again, everyone, and take care.